Anterior process of calcaneus, take 1. This is now a little video to show us how to identify the anterior process of the calcaneus. This is a really useful technique to have when you're differentiating lateral ankle injuries and to add to your protocol, if you like, of anterior and lateral ligamentous structures when you have patients presenting with ankle trauma. So to find this anterior process, you're going to pop your probe on, and on the right of the image here we've got we are proximal essentially on the calcaneus, and on the left of the image here we are going to be onto the cuboid, and you can see the level of the probe. It's not quite on the sort of the joint between the plantar and the dorsal aspect of the foot. It's a little bit higher up, and we're going to roll the probe up, and you're going to see this very distinctive little step at this point, which you can see beautifully here on this system. And what we're looking at here is the calcaneus coming down. This is the anterior process, and then this is the articulation here with the cuboid, and this is the calcaneo-cuboid joint in this region here. And when you're looking at this on ultrasound, it's important to just fully dynamically run all the way through that anterior aspect and all the way back through. And this is where you can often see small fractures. So appreciating the cortical outline here should be smooth. If you were to see some jagged edges here or cortical irregularity at this point, then you would be suspicious for an anterior process fracture, and you'd want to ensure that you had an X-ray performed with a lateral view, and specifically on your request asking for an evaluation of this region. But that is how you find the anterior process of the calcaneus. A really, really useful one to add to your ultrasound repertoire, looking for those maybe slightly more occult fractures and injuries in this region.